Okay, we'll go ahead and start our education committee meeting here. Just as a reminder, we are live recording. Anything you say or put in the chat will be recorded and put on the website. So first off, roll call. I'll give it to Shelley.
Amber Wright, Brian Smith, Chester Key, Christopher Gilbert,
Present.
Jason Johnson,
Here.
Joseph Waterford,
Present.
Kyle Henson,
Present.
Matt Shaw,
Present.
Orlando Alcordo,
Present.
Sandy Nygaard,
Present.
Sharon Hollingsworth,
Present.
Phoebe Merrill,
Present.
Troy Hoke,
Thank you, Shelley. Next on the agenda is the chairman's report. So in your packet, you'll see attachment 3A is the attendance report. If you missed 2 or more consecutive meetings, the Bureau will reach out to you. Make sure that you are still interested in remaining on the committee. For the vacancy report, we have no vacancies currently for this committee. And also, I don't know if it's in the packets, but there is a 2025 meeting schedule that has been drafted over at Shelter.
I just linked it. I did.
Thank you, Sean. Anything on the calendar that was it?
No, just a reminder on the calendar that for 2025, we are not on our normal meeting cadence. Historically, we were always on the third Thursday. There were some big overlaps and conflicts with the 2025 calendar. So we've kind of tried our best to work around that. We recognize that I know in January, we now do have one conflict on there, but just that is why we have the meeting changes. So if you've kind of planned historically, we've always at third Thursday, just a reminder, please look at the calendar and make any adjustments that you need to work around that.
Thank you for that heads up. Moving on to the Bureau report, I will turn this over to Chief Garcias.
Okay, thank you, Dr. Rice and Dr. Bradley. We have some slides that we will share today, and this packet will be distributed as part of the information from today's meeting. I will share the first 9 or 10 slides, and then I will turn it over to the rest of our team to provide their update. I want to start by acknowledging that this week is Crash Responder Safety Week. And the theme for this year is Responders Ahead, Reduce Your Speed as You Proceed. We've been promoting our traffic incident management responder training, and there's information provided on this slide if you click the link. We're also very grateful to all of our local agencies and state agency partners that have teamed up to really promote Crash Responder Safety Week and all of the training and safety resources that are available to our first responders, both on and off duty. Thank you for all you do, and please stay safe out there. Going on through the rest of our slides, wanted to acknowledge that this past September at our State Trauma Advisory Board report, or at our advisory board meeting rather, we celebrated 30 years of STAB, and the STAB the board also voted to approve this year's annual State Trauma Advisory Board report that is available online if you want to check that out. We're very pleased with the progress of Arizona's trauma system from 1993 to present. If you go to the next slide, we now have hit over 60 Arizona trauma centers. And we just want to thank everybody that has been a part of building Arizona's trauma system, and encourage you to check out that map and also check out our reports. This year's report is a dynamic data dashboard that shares information from both our EMS partners as well as the trauma system. Going through the rest of our slides, we want to spend a little bit of time here talking with the committee and all of our stakeholders about EMS portal changes. Some have gone into effect and some are going to be going into effect in the next 6 months. If you or your agency have a user account in our EMS portal or our hospital portal that is now hosted by ImageTrend, we want you to be aware that number one, that bullet point there, EMS agencies can now more easily manage their rosters and secure who has access to their data by syncing up the portal with your AZ Peers Elite account. If you are an agency that's interested in doing that to make your lives easier, we have a little bit of information that's linked there about syncing up the portal to AZ Peers. Please check that link. And if you have questions about that process, please reach out to Ann Godfrey, our trusted expert when it comes to AZ Peers and all things data. We also wanted to share that because of security changes, the EMS portal now requires that all emails that come from the portal must be sent from the email address dhs@arizona.imagetrendlicense.com. They are no longer going to be coming from a .gov email address. And that's important for us to share with you, because if you are a user of that portal and you're receiving emails from that portal, we need to make sure that you guys are going into your emails and that you are unmarking that or flagging that email so that it comes through and doesn't get stuck in your spam folder. We have heard that some of those .com emails, especially, can get stuck in your spam folders. So please be aware that there are filters and that you may need to flag that email address. That indeed is a legitimate email address that we're going to continue to socialize so that if you're submitting an app, you can receive emails from the system confirming we've received your app. And similarly, if there's any other correspondence coming from that system, it will be coming from that email address. So please be aware and please share and socialize that information with your agencies and any users of that system. Finally, we are rebranding here at the state. You'll see in our slide deck that we'll share out with you guys the new color scheme and new logo that the state of Arizona is migrating to. I don't know that we have it on this slide, but in future slides, you will see we're moving to that beautiful purple and copper color scheme with a new AZ logo. And so the next thing you'll see is that our Arizona EMCT certification card will also have that logo and that color scheme. And we look forward to working with the community before we roll those cards and that new design out, but wanted to give you a heads up on that. The next big item that we wanted to share with you are upcoming job opportunities and recent promotions. We don't have all of our team members in the room today, but I want to congratulate Noreen Adlin, who has accepted the role of our Deputy Bureau Chief at the Department of Health Services after serving in an acting capacity for the last year in that role. We also have Kim Bain, who has accepted the role of Section Chief of Trauma and Pre-Hospital Coordination after working in an acting capacity. We're very grateful that both of them have continued to share their talents and gifts with the Department of Health Services and our state partners across Arizona. Between the two of them, they have beyond 60 years of experience in EMS trauma. And again, we look forward to them continuing to work with all of our stakeholders. I also have to share with you my news that I am officially transitioning into the Deputy Assistant Director role here at the Department of Health. I've been working in dual roles now for almost a couple years, and we will be backfilling that Bureau Chief position for EMS and trauma. You will find that on our avstatejobs.gov website shortly. There's a few positions that we will be recruiting for that are listed on this slide. If you know anyone that's interested, we'd love to talk more about that. It is a job within the ASRS system. And, we're really looking for qualified candidates to continue to build on all the collaborative relationships built over the last few years. We'll keep moving. And at this point, Shelley, I'm going to turn it over to Dave Hansen. I think we have slides 30 and 31 that Dave and Julia will cover next.
Thank you. Just a reminder for the naloxone lead behind program. The link to the DHS website is on the slide. I emailed on the slide, and as of this Monday, we have about 3,200 providers trained. I've shipped out about 3,000 kits. We have 47 agencies that are participating, and we've scanned in about 400 kits. So if you're interested, the training's free. It's online. That's kind of training. Just get a hold of me, and I'll get you connected. Thanks.
And then I just give a quick update on the strategic plan. So as you probably have been aware, we've been working on developing our Bureau of EMS trauma system statewide. strategic plan over the last year or so, and even have been working on needs assessment and things like that before that. So we are excited to share that we did present our final draft at EMS Council back in September, and that was approved. So next steps will be moving towards adoption of the plan, the implementation, and doing work groups and things like that. So definitely stay tuned for more information on that. And again, thank you for your participation in that process.
Thank you, James, and thank you, Julia. Dr. Rice, it is an absolute privilege to serve Arizona and work at the Bureau of EMS and Trauma, and I think that is our update on report for today.
Thank you very much. So moving on to our discussion and action item. The first one we have here are the draft minutes. So in your packet, 5A attachment or the draft meeting minute from last month. I'll give folks a moment to view them, and then I will take any motion to discuss.
Sandy, I'll move to accept.
Thank you, Sandy. Thank you, second. Thank you, Jason. Are there any edits or changes, anything you feel needs to be amended for the draft minutes? I'll give folks just a moment to speak up. Hearing none, let's go ahead and move to a vote. Or did I hear something? Nope, maybe not. All right, all in favor of approving last meeting minutes? Say aye.
Aye.
Are there any opposed? Are there any wishing to abstain?
Brian.
I wasn't here, so.
Oh, okay. Thank you. Next agenda item, to discuss training program, psychomotor exams. I'm going to send this over to Dan.
Hello, everybody. Thanks for giving me a second here to talk to you about the psychomotor skills. I want to just briefly talk about the history of where everything sits, what we presently do, and where we would like to go in the future. Give me 1 second. I'm going to try to share my screen here. There we go. Okay, so just really quick, the history of how we got to where we're at. As you guys may be aware or may not be aware, National Registry sunsetted its requirement for the psychomotor skills exam for certification. That happened on July 1st this year. One of the things that happened with that is the state of Arizona still requires the psychomotor skills exam for your Arizona certification. So what we did was we, in essence, mimicked what National Registry was doing. So for those of you that don't know, if your paramedic students are going to finish up their course, you would email the training center manager here at DHS, and he will send you 2 examination packets. One is for initial testing, one is for if anybody needed to retest. Anytime those packets go out there, we track them. We know which region got which packet. Currently, we have 10 packets built to be sent out. So we always manage and track to make sure the same region didn't actually get the same exams, to try to keep it as confidential as possible. So that's where we're currently presently sitting. With what happened when we were building these packets, we noticed that in the rules, it actually states that the testing material and those scenarios do not need to come from the state. It actually stipulates that they program themselves. The program managers can actually create their own scenarios. They just need to sign an attestation form that's provided by the state of Arizona stating that their students actually pass a psychomotor exam. And that's actually the form that I built that you see there on your screen. Is the one that I'm kind of building out and would like some feedback on. So in essence, to just take you back a second, I researched everything, right? For the National Education Standards, NASIMSO, COAIMS, and again, nothing really stipulates that your scenarios need to come from the state. Now, I'm leaning towards two pathways. One, we keep the present way of doing things where you could email the training center manager and he will, in essence, send you the training packets. Or if you want to create your own scenarios, once again, you would email the training center manager and he would send you this particular form that is stipulating what you need to do. I'm going to scroll down on it a little bit so you can see the stations that are required. It gives you a little bit of a update on what those involve. But let me take you down here to the bottom. It does require the program director and medical director to sign off the attestation stating your students passed the psychomotor exam. So in essence, creating two pathways of how to end up at that psychomotor exam for the state. Like I said, one, you get the actual exam material from us, or two, you get this attestation. Now, either way you go, I just want to make sure that everybody understands, either way you go, we are tracking where these go, whether it's a scenario based or whether it's the attestation. We know which programs are using our scenarios, which programs are using their own. And after we build a big enough data set, we can start actually tracking and seeing first-time pass rates, second-time pass rates, and seeing if there's a correlation between either one of the pathways. So that's currently where we sit. And so I just wanted to open it up for discussion on utilizing this part of the rule that stipulates that you only need to sign an attestation and you can build your own scenarios as the program or medical director.
Hey, Dan, Kyle here. I have a question.
Yes, sir.
So I reached out to the bureau chief in the state of New Mexico, and they have an interesting sort of take on some of this stuff. And I'm reviewing Kyle Thornton's email as we speak. So what's the criteria? I know based on the document I'm seeing here and that we have in the packet. Let me back up a little bit. What's the review process to validate what the training institution, i.e. the college, et cetera, is including in their scenarios? Who vets that to make sure it's an adequate scenario?
For the way the rules are written, currently it's the medical director for the program.
And the state doesn't have any involvement at all, so we could have in theory, a paper medical director, and the program director puts this out, and that's what we're then credentialing someone to carry a certification in Arizona, just to confirm what the rule reads. Is that accurate?
The way I'm reading it and all the research that I've done, yes, unfortunately, that's the way it could potentially be as it currently sits. And that's the thing is once we gather enough data, then we can come with actual information and data to potentially in the future change the way the rules are written.
Yes, I have some pretty, I'm sorry, Shelley, go ahead.
So I would say the one thing that is in there is that Dan in his role does audit training programs. So part of getting having your training program certificate, the state can audit to ensure that this is being done. So that is something where if he audits and he sees that there's no scenario, the scenarios are not meeting a national standard, that is the only kind of oversight that the Bureau has at this time with the current these at on the process.
Yes. And
That's
Dan,
good to know. And how often are
Kyle, I'm sorry, real quick. While we're going through the questions, I think Kyle brings up a good question. Dan, I think it might be the last page of this document. There is the attestation. There's also it might be a different format I'm thinking of, but the course roster with the student's name at the very bottom. There is going to be an audit trail that each training program would have to complete this paperwork on a department required form per the rule. And that provides the opportunity to go back and look at this from an audit perspective as well. So I hope that helps to Dr. Dan and then Kyle's questions. Back to you, Becker.
Thanks for clarifying just for a second, and I'll wrap mine up. Dan, how often does that is this a random, can you walk me through the audit process? Is that a random, or is that only when a complaint is done, or do you see every training institution with an ALS program or training center with an ALS program, and do they get an annual review?
They get reviewed once every 24 months. Or let me rephrase that. It's once every 24 months unless there's a complaint or an issue comes forward.
And the last follow-up to that, is that an in-person?
Yes, that's in person.
Thanks, that's all I have for now.
Yeah, Orlando, I see your hand up.
Yes, thank you, Dan, for doing all this heavy work. On the statement on the top part, can you kind of maybe add a title in here? Because it looks like these are all paramedic. Would EMT be in this same platform that you're grading a draft on?
This one is currently for ALS programs only. That's the one we're working on. In the future, yeah, we can absolutely add in a title for BLS programs, but right now we're just trying to work on the ALS portion, since that's what National Registry had sunsetted.
And in addition to, and I can see the concerns about, what are you staying consistent with these scenarios and these stuff. The advantage of being in the college system, we have an instructional council that, we can do a consortium and vetting things on what that scenario would look like, if that's, the question based on the number 5 item. So certainly, and number 4. So certainly that's, maybe we can start doing that also. I'm sure my colleagues will probably share things, and, hopefully you guys will have scenarios, bank of scenarios that maybe some training programs might need help on.
Yeah, and just to add to that, it's one of the things I'm working towards is we do bi-monthly program director meetings. And these are some of the issues that I would like to bring up at the meetings if we want to all get together as program directors to help build those scenarios and vet the scenarios and exam packets that we're using.
Thank you, Dan. Well done.
Thank you.
All right, I don't see any other questions or any other questions in the room.
Is that form available in hard copy to us yet, or is it just strictly on Dan's computer?
This particular form is it's still in draft, so I haven't sent it out to anybody. I've sent it out to some people in our bureau, but other than that, it's not available yet.
Kyle?
Thanks. Yeah, Dan, thanks for the hard work on it. That actually was one of my questions. You may have answered it on how we could, can we give input on that form that's there? And I have some pretty serious concerns on the process here, and talking to several other state officials and where it's at, and being involved in education for many years myself. It seems like there's, I don't, we don't want the Bureau to be the EMS police, right? But is this group of program directors policing themselves? And I'm not sure once every 2 years it covers a validation. National Registry just speaks to a minimum level of competency, and I'm hoping that I don't know. I would love this to have a longer conversation than a quick agenda item for this document that we're just seeing for the first time today. And I don't know if you're asking for advice, or obviously we don't, approve this. That's the state's prerogative. But man, I see some loophole for potential of programs. Not that anyone intentionally does it, but for someone to cut corners and not be caught, and us have a provider that perhaps shouldn't have gotten through that process.
Kyle, I share your concern, and yeah, I'm looking for feedback. If you want to help with this particular form, this is just the first shot at it. Honestly, because It is in rules stated that way, that on a department provided form. Any and all feedback is absolutely welcome and accepted, and I'll take whatever I can get.
Thanks, and I'll end it. I see TJ and Orlando had some things. Obviously, we want to get everyone's input. Perhaps that stems to a bigger concern of that the rule needs to be changed, right? Which I don't know how often this particular rule opens. That's DHS's wheelhouse, but totally get what you're saying. Merely trying to be compliant with the rule, but maybe we need to have a deeper dive on the rule. And if there's any other subgroups on this particular document or this process for testing that you've created, I'd love to be involved in those too. Thank you so much.
TJ, and then maybe I'll let Pete Garcia or Gail weigh in on this as well. TJ, did you have something? We lost TJ.
He's probably muted.
Heard his name and bailed.
There he is. Go ahead, TJ.
Out.
Yes.
My wonderful microphone. So I appreciate Kyle's concern and some of the other ones there, but just as a reminder, National Registry sunsetted all the BLS testing quite some time ago and put it back on the program directors and the institutions, like the training centers, to make sure that they were essentially still following the same guidelines that Registry had put out. And we still have those requirements for all the BLS refreshers and challenge refreshers and all the ALS challenge refreshers and refreshers. So it's all the same. We're just now treating the initial paramedic training the same way we're treating every other certification there. And for lack of a better option, we just kind of continued the National Registry process for all the previous ones. And kind of what Dan's got in play now is that same process, is we are effectively just continuing what Registry did until we come up with something that's better for us in our state. But it's just treating medic like every other state approved class that's already in place with no real oversight other than the programs and then evaluation by the state every 2 years. So it's not that different.
TJ, Shelley, could I just respond to TJ's comment real quick?
Of course.
And I completely understand that. I think it's a very, very different level of oversight for an EMT than a paramedic. But I understand what you're saying. It lends to making it the same, and that's what I have disagreement with.
Right. Well, and I agree. And that medical director component, I think, is the big one. It's just like all the CE programs. As long as the training program manager and the medical director sign off on it, that's all we need to have it approved. So that's where really having a strong medical director, I think, plays into it.
Thank you guys very much.
And then this is Rachel. I'll chime back in one more time. I have to say, I really appreciate the discussion and the committee allowing us to bring this agenda item as a discussion item to you all to get some feedback. As we move forward, because rules right now specifically say that there are two options in terms of completing that psychomotor exam following the current pathway and the way that we've done it now for many years, and then also a pathway that allows for an attestation on a department required form. While the rules currently say that, we are committed to working with the education community to make sure that we are following those current rules. And I just have to thank Dr. Dan for looking at this so closely and offering that opportunity for us to continue to follow up, audit, and look at the situation closely so that we understand those two different pathways and any differences that exist. So certainly as this format rolls out, I don't know how many training programs may opt in on the ALS side to follow an attestation process, but it will allow us the opportunity to work closely and come alongside those agencies to make sure that our rules indeed are offering that level of education that we would expect here in the state. Dr. Dan, I don't know if you have any final last comments before we move on through our agenda.
My only final comment is anybody that has concerns and all that kind of stuff. I have concerns too. And if you want different verbiage or things added to this particular document that you think would help, please feel free to send them to me, and we'll get it added and take this rough draft and keep working on it.
Kyle, you had one more comment?
Yeah, thanks. Dan, could we get this? Unless I missed it in the packet, I thought you said it was still a draft. Is there a way we could get it and then hopefully redline it or at least throw some input on it?
Yeah, I'll look into getting it sent out to you guys.
Thank you so much.
Another hand is raised. Vivi?
Yes, I put something in the chat.
I saw it, ma'am. I took note of it.
Great. Thank you, Sandy, for your comment. All right. This is just a discussion item. We don't have to take any action, obviously. Yeah.
One more comment.
Oh, there's one more. Okay.
I just have a quick question for clarification, because we just were in the trainings and certification rules. Is that actually in statute rather than rule?
It is currently enrolled. And I think, Brian, you had signaled in the room that not everyone online could see you, that those rules are reviewed every 5 years. The department can make note in the interim of any concerns that have come up with respect to those rules, but they are typically reviewed and updated every 5 years. So certainly, as part of today's discussion, we have made note of those stakeholder concerns that have come up, as we will be reviewing that carefully moving forward. Thank you, Dr. Rice.
Thank you. All right. I will move on if there aren't any. There's a comment from Kyle in the chat you guys can read. Moving on to our next agenda item. If I can get a motion to discuss, submit, and approve some updated training from the Pages Investigation Work Group on a couple of items here.
So moved.
Thank you. I think we have the toolkit and the training together. Is that true? Looks like it's all together. Great. So Pages Committee and Education Committee very thoughtfully reviewed 2 pieces of training that have been around for a little while, but were due for some updating. So the first one in the packet will be the actual training, the place safety training, and along with that is a day packet. So, or a toolkit that goes along with it. So the history behind this is this was a previously grant-funded initiative, provided training, collected some data on training, and that grant has since ended. However, Pages and Education Committee feel that this training still is worth maintaining and updating with the DHS. So with that, we'll kind of scroll through some of the training here. My type is a little weird, but if you go through here, there weren't a large number of changes made. The one thing we are waiting on to update this finally, so the Fatality Review Committee actually has, and the state will come out with some updated data. We're going to wait for that updated data because I think it should be out any time to update the data to the most recent. I think it's 2023 data, if I'm not.
Did you that?
Did you? Okay.
You updated the data and the, did you cover it?
Oh, so this is the updated data? Great, perfect. Okay, awesome. Oh, with the updated data in here, you'll see that the most of the updates in the beginning are some of the demographic information specific to Arizona. If you continue scrolling, you'll see how many cases there were. And it goes on to give some training on unsafe sleep environment. Mostly to do with co-sleeping, so it tends to be the primary risk. It goes through bed sharing. A couple of things were added for cribs and bassinets. So there are some boards that was added as something that potentially could be of a risk. Moving on, changes to this one included some sort of specific items about types of places that you should not be put to sleep on. we added. Yeah, and then we added a line related to medically complex children. So we didn't want to give EMS providers the sense that some kids don't have exceptions to some of these kind of rules. So there are some kids that sleep in sort of inclined positions or in different positions or have devices they have to sleep with that may dictate different requirements for them. And so there are some things that physicians may recommend that may seem to go against some of the general rules here. The next slide. No changes here. And then this one made the specification that a sibling also, so a twin co-sleeping was a thing that continues to come up as a risk. So made that addition in here to discuss sibling co-sleeping as well. And on the next slide, again, twins or multiple babies should be in their own crib or bassinet. And scrolling through a few more slides, I think a lot of these other things were not changed. Here's what was the EMS provider. I don't think that was an addition. I think that was there. How to approach a family. Like for test and some additional resources, which were kindly updated by some of the bureau folks and cases folks. That was kind of it. So that was the change made to the training. Does anyone have any comments, questions about the training specifically before I move to the toolkit that accompanies this? Okay, so then we can maybe scroll through this toolkit, which also didn't have a large number of changes in it. It's sort of a scenario-based toolkit for teaching. So within here, there are several scenarios that a trainer could use. There's about co-sleeping scenarios, about cluttered cribs, those sorts of things. And then after the scenario, there was a list of FAQs. I don't believe we need any additions to this FAQ. And there was a post check. So we removed any reference to a pre-test since this isn't no longer a grant funded program, but did elect to leave the post test for those that wanted to use it. Updated some of the resources for where to get information if you don't have a crib. And then there were a couple of flyers, things that could be posted. Which were, I don't think these were, actually might have been new one. I think some of these might be new graphic. I can't remember.
Shelley, quick question.
Go ahead.
This is a really great document. I like who created it. Was two questions. One was who's the primary intended audience, and then was this drafted by DHS? Great work. I love the questions and a little post test as well.
Thank you, Kyle. So I believe this was created by PACES initially, but I'm not sure if it came out of PACES committee. It might have been before that.
I'm going to defer that to Julia because that was just one. Yeah, it's not a piece.
Okay, so it was a grant funded project. PACES did create this from the beginning, and it was approved in its initial form by the education committee. This is just the update to review it. So
great document. Thanks.
Yes. And the intended audience is kind of any EMS provider that you would want to give this training to. So would obviously qualify for, pediatric type CE. Any other comment, question, issues with any of the edit?
Well, if they have any like handouts or brochures that the guys could use when they go on a call that they can carry on their rigs.
I think the only handout there were the one here. So,
I know initially the grants supported the handout,
yeah,
but I don't know.
We just in the toolkit kind of have some existing resources like the
Yeah.
grid card that can be
Yeah.
handed out, and that's actually from a different ADHS program.
yeah,
But yeah, that's kind of what we have.
Maybe around, do you want to follow up with that? We can find out if there's any resources to provide that to EMS, because there's other different parts of the department that work on these projects may have resources. Here, that's that.
good question. Thank you. All right. If I have no comments or additions, would anyone be willing to make a motion to approve the training?
Let me approve.
Aye.
Or
Thank you both. Great. All in favor, say aye.
Aye.
Hi.
Aye.
Are there any opposed? Say nay. And are there any wishing to abstain? Wonderful. Thank you all. And thank you to those who helped edit. Took a couple meetings, but we got it done. Moving on to the next item, discuss amend and approve TXA training module. So do I have a motion to discuss? Second, great, thank you. Okay, so this would be a new training for this committee. This isn't one that existed on the website before, so maybe in usual fashion, we will just kind of flip through some of the slides. Give you folks a moment to kind of take a look, see if there's anything specific. Beginning slide related to some demographic information. Some slides about hemorrhagic shocks. Shocks management. And signs and symptoms, so signs and symptoms of hemorrhagic shocks. Bulleted information and some information on, sort of amounts of blood loss that may lead to shocks. Early warning signs for deterioration. And the next couple of slides, so high index of suspicion for occult hemorrhage. We tried to keep the list specific to things that are mentioned in the TTTGs as indication. There are obviously others types of bleeding. Next slide is related to fractures, associated blood loss with fractures, and how much blood loss could result from these fractures. And then the beginning of TXA. Pharmacokinetics. A really funny video about how TXA works, which was provided by Phoebe. That's right. Dr. Merrill had this really funny video she loved. We all watched it quite during the meeting. Very good. So a little more about how TXA works. Indication. These are directly from the TDTGs essentially. Contraindication, adverse reaction. This one we elected to keep fairly vague, trauma center transport. So per agency guidelines, so we have such a variability across the state and guidelines. And then how it's given. We left the dosing range in here. We know some folks use 1 gram, some folks use 2. So we left this as a range. Mixing instructions. General trauma guideline and child first, which both mention the TTP.
One quick question, sorry, about the, how to administer it. In our TTPG, we do not have the time frame over 10 minutes. I know that there has been some conversation, so I just wanted to bring that up for the group to discuss. Do we want to keep that time frame, you know, in terms of administering it?
Yeah, I think 10 minutes is what's listed in the package insert for TXA. However, there are studies that shows that the risk of hypotension is probably less. And that giving it as an IV push is probably fine. So that's kind of why we have it in there both ways, but definitely, please discuss and let me know what you guys think.
I feel like we'll point that out to what it is different from the TTPGs.
We just don't say a time frame anymore. I don't remember.
Correct. There's no time frame on it. Yeah. And that's something that can be added if the agency is training as this and you have it differently in your guidelines, you can just adjust that slide.
Yeah. Any other thoughts on that? Okay. Anything instruction? Guidelines, obviously. And then we did at the end put just some basic information from some of the main studies if anyone wanted to use these in their training. So some information from CRASH 2, from the MATTER study, and the pediatric and women trial. So they're the most commonly cited. There's certainly other much more literature on this, but sort of the ones that folks are most aware of. So any thoughts, questions you would like to see? Good. Okay. There none. Take a motion to approve. Second. Wonderful. All in favor of approving the training, say aye.
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 Any opposed? Say nay. And any wishing to abstain? Wonderful. Thank you all again. Next on the agenda here is discuss certification data on rural paramedic scholarship program.
Is Julia.
Or Julia.
Yeah,
Okay.
I'll help tag team it with
Okay.
Julia and we'll go to Shelley, if you will, the Bureau update slide 19. I promise to be brief. The Rural Paramedic Scholarship Program is actually a bit of a passion project and a partnership between our 4 EMS regions and the state of Arizona based on the needs that we identified in our statewide needs assessment. In fiscal year 23 and 24, each regional council received an additional $100,000 grant beyond their typical annual funding. And that was specifically to provide rural EMCP education in their regions based on the greatest needs that each of the regions identified. I won't go into deep detail in terms of what each region was able to accomplish, but we did receive reports from each region and wanted to share those results with you as a committee. In the central region, we were very pleased to hear that they were able to provide scholarships and then certify 10 paramedic students each year as part of this program. Moving on to our next region, in the northern region, they took a bit of a different approach. They were able to provide partial scholarships to students and agencies across the entire region. And it looks like in the first year, 86 scholarships resulting in 73 certified paramedics. And in the following year, I know that you guys are still collecting data in the northern region, but similar results. Going on to the next region, we had the southeastern region who was able to work with all their subcommittees throughout the southern region and their four counties down there. There were 21 scholarships awarded in the first year of the cycle, and 9 students certified as EMTs. And in 2024, we are still waiting to see the results of how many certified EMCPs we have after that most recent cycle. Going on to our western region, I know the font is a little small there, but in the first year, 18 students were certified as paramedics. And in the most recent cycle, I know that there's been additional programs aimed at both EMTs as well as paramedics. And we have seen 9 students certified so far this year in those rural communities. And 6 additional students moving through the certification process at this point in time. Our next slide is just a quick summary overall. Let me pause for a minute. Our next slide is student feedback. This was really wonderful to see in one of the reports from our regions. Being a paramedic has been such a blessing. I would not have been able to attend the course had we not received the award. I am extremely grateful for the opportunity to increase my skills that have positively impacted the community in which I serve. The amount of community pride we've seen throughout this program over the last couple of years in students in these rural communities being able to not only go to school, but then come back and serve those communities where they live. It's just been tremendous, and we're very grateful that that program was able to move forward for 2 years based on the funding that we did have. The overall impact to date has been 250 students receiving scholarships based on need in each region, and 120 so far and counting in terms of students that were able to then become certified at that higher level of training through this program. And then, of course, go back into the system and serve those rural communities where there is the greatest need. The next slide is a map that we previewed a little bit earlier today. It looks at each county throughout our state in terms of the number of people served per certified EMT or paramedic. The highest ratio of population per EMCPs in Arizona is Pinal County at 798 people per EMCP. The lowest ratio of population per EMCP is Navajo County, which is currently at 226 people per EMCP. I want to point out that this map currently shows all levels of EMCPs in the state of Arizona. If we were to look at paramedics, which this program was aimed at increasing the number of paramedics per rural county, if we look at paramedics, that number is much lower, especially across our rural counties. And so this partnership really was tremendous in demonstrating that our regions were so effective at not only partnering with the agencies and getting students funneled into these programs, but also building those relationships with our training centers and being able to create opportunities for so many students to cycle through. This all was happening at the same time as there being an award and a legislative appropriation for funding for nursing education. To be honest, the amount that went towards nursing education in the state of Arizona 2 years ago was in the ballpark of 40 million. When that happened on the EMS side, we were only able to identify $400,000 to put towards this project. I think that overall, as we look at the results of this program, of course, it's nowhere in the realm of 40 million, but with $400,000 each year to be able to now have investment in over 120 paramedics now certified to serve in those rural communities, I think we can mark that as a success. We have heard that there may be interest in upcoming legislative sessions to go back to lawmakers and see if there is an opportunity to continue programs like this. And our hope is by showing these results that perhaps this could be a model in the future should funding become available again. Overall, I just want to say a big thank you again to our regional councils for helping us to develop this program and to allocate that funding where there was the greatest need. And we hope to be able to see something like this continue again in the future to support those rural communities. I'm not sure if there's one more slide or if I missed anything. I'm going to glance at Julia. Okay, thank you for allowing us to present the results of that passion project, and hope to hear more to come in the future.
Julia, did you have anything to share? No? All right, thank you very much. All right, moving on to our next discussion item. Discuss upcoming table updates the scope of practice in the drug. And
All right, so hopefully everyone in this room and online is enrolled in our self-delivery. If you are, you would have gotten this communication, which kind of gives the update regarding the changes to scope of practice and the drug table and kind of the go live date for all of that. So we are very excited that effective essentially New Year's, we will have a new pathway for certification and training within Arizona, which really starts at the EMR level and extends all the way to critical care endorsement on top of your paramedic certification. So a big thank you to this group. Many of you participated in that public meeting that we held as part of the education committee, looking at the rules, looking at kind of making sure that's best suited the entire state. And so we're very excited that this is now being approved and we're scheduled to go live essentially with the new year. So this includes the updated scope of practice, the new training and certification rules, along with the new drug table. As I mentioned at the last meeting, we do want to remind anyone that utilizes paramedics in the hospital, especially, we did hear loud and clear the request to add oral medications to their drug tables for approval. Many of those were approved and added. However, the group, especially the education committee, really felt strongly that those more critical care type medications should be administered by a paramedic with a critical care endorsement. So medications that were for the hospital-based paramedic are going to be transitioned to specifically a critical care endorsed paramedic. So I want to make sure that you are aware of those changes as the committee approved that and were signed by the director. So just a quick update and summary on that. I will open to any questions, but hopefully everyone has received these. Once these are in effect, we will post them to the Bureau's website. We just don't want to be in a situation where we had two different versions of scope of practice and two different versions of the drug table posted. So we have tried to share this via the Gov Delivery communication. So if you want to start your training and education, those type of processes, it's available to you, but it won't be posted to our website until they officially go live. That is the very short Reader's Digest.
Wonderful. Anyone have any questions for the Bureau on the class?
So once the 31st of December rolls around, on the EMS and travel portal where providers log in, that's where they would go to fill out their form for the critical care endorsements, and they would submit probably their FPC or CCPC card, and that's pretty much all that they would need to submit at the moment.
Yeah. There's a button we have to push on our side on December 31, and then that app goes live January 1.
Thank you. Good question. All right, I will move along. If there are no other comments or questions, I don't see any hands up online. Wonderful. Next item is discuss, amend, and approve forming a joint work group of cases for children and youth with special healthcare needs. Do I have a motion to discuss?
So moved.
Thank you. Thanks, Brian. Was there a second?
Second, the Sandy.
Thank you, Candy. All right. With you or?
Originally came from the EMS for Children program. We received this question in the field for what is there for guidelines for SHIN. And so we developed this, and we're hoping to work collaboratively among cases and the education committee to review this document, make sure everything's in line. And then once that's completed, then we need to run some training with this as well in the future. So a lot of information here. I would love as many people on the education committee to join cases and review it.
So this is not a approved document yet, is that correct?
Correct. So one of the discussion pieces that came up was, should this be a guideline? And I explained kind of the way the EMS guidelines work with our TTTG process. This is really looking through this as an excellent education, but it's much more expensive than what we would see in our treatment guidelines. And so the recommendation is to see if this committee would like to join with cases as a kind of a work group, similar to the state fleet committee, and create this into kind of an educational opportunity. Really, this is a pretty phenomenal amount of information with a very, specialization population. So this would be a great way to kind of build that training that then can go out and be available to EMS agencies to give. So I think this will be well used by EMS agencies. The more we get out, the kind of training this committee has put together, I often, when people go to the website, they're amazed at the training that this group has put out. So that is kind of the active to look at this as a baseline. Okay, let's create training. I think a lot of the work is done. It would really just need to be put into a format that can be pushed out for training, and this could be a kind of a resource to align with that.
Yeah, exactly. Yeah, I think it was the very well received as a training module. So does anyone have any questions, comments specifically on this? Support for or a motion to form our work group? There's a second.
I second
Great.
that.
Thank you, guys. All right, so this is a motion to form a work group to create training for children and youth with special healthcare needs. All in favor, say aye.
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 Are there any opposed? And are there any wishing to abstain? Okay, wonderful. As usual.
And any volunteers,
Yeah, as
if
usual,
anyone that wants to volunteer, we'd love to
please,
have you now.
we'll take those now or show. To,
I see Brian, are you volunteering, Brian?
Yes.
well, thank you.
I see Brian Smith, Dr. Woolrich. I heard someone else that. And then also we'll get members to be a voting item for them after the stage.
Perfect. Wonderful. And obviously, if you would like to, or know someone else that would be great to help out, please feel free to send that to Shelley also. All right, moving on, maybe a couple more items here. H is our standing items. So this is our training module. This is just an attachment in here in your packet that lists all of the trainings that we have, and the latest approval date is what we use to sort of track when things need to be updated. Item number 6, please let me know now or reach out to Shelley if you have agenda items that need to be considered for the next meeting. I think we already have some that came from this meeting today. In addition to those, if you have others, please let us know. Item 7, we'll call to the public. Hearing none, I'll move on to upcoming events. There's a list of upcoming events in your packet. These are also listed on the DHS's website. And our next meeting will be March 20th. And if there's nothing else, we will adjourn our meeting. Thank you. Do I need a motion to